WHO defines health not as the absence of disease, but a state of complete well-being, physically, mentally, and socially. Most of the time, people visit health facilities at the first sign of illness. But this should not be the case. This is actually too late. So we basically encourage people to visit the health facilities for screening. And this screening essentially helps us to detect illnesses quite early and even potentially cure some or prevent their progression. So essentially the role of screening is disease prevention, and that's why we encourage people to visit the health facilities even when they're not feeling unwell. It's interesting to know that a wellness checkup does not actually start at the clinic. It usually starts from the day before. Normally we prepare our patients and advise them to fast about 8 hours before they come for a checkup so that we are able to get a good assessment of their body. Now, once they come into the clinic, we begin by vital signs assessment with our nurses. So we start off with blood pressure, pulse checking, and in certain population we also do random blood sugar screening. The nurse is also able to do some basic biometric tests like the height and weight that helps us to calculate the body mass index. This then would help us to do a nutritional assessment and recommendation. They now come to the family physician's consultation. We begin the visit with a series of questions that will help us to know the person seated in front of us a little bit better in terms of their past medical history, any health conditions they've had in the past, admissions, as well as their family history. After that, we go ahead and do a physical examination. This is basically a head-to-toe assessment. But again, based on the history that we had taken, we may decide to focus on a certain system and examine it a bit more. Subsequently, then we would send the patient for investigation. There are certain tests that are usually recommended, but again, we tailor it based on the history we've already taken and the physical examination that we have conducted. One of the most important tests is a full blood count. I like to call it a window to one's body. This usually helps us to look for infections with a white cell count. A hemoglobin count will help us to detect for conditions like anemia. We can also look for platelet count that would help us detect for bleeding disorders. It also helps us to detect for early blood cancers like leukemias. We also have kidney function tests that usually helps us to look for creatinine and urea, which are important functions of the kidney. But not only that, it also helps us to detect for electrolytes, which are important in terms of how one's body functions. Then we have the liver function test that also tells us about the health of the liver. Others include urinalysis that can tell us more about the state of the kidney and even certain conditions like if one has blood in the urine or even if one has excess sugar within their system. We advise our clients to come in annually. That's just for a basic wellness checkup. But in case of something that has been detected prior and needs ongoing surveillance, then they may need to come a bit more often as advised by the family physician. But routine, we normally do this annually.